down on the list, below skin cancer, almost number 10 on most common female cancers each year. It's the 10th most common cancer, but it's the 5th most common cause of cancer death. So what that means is that not that many women are getting diagnosed with ovarian cancer as compared to the number of women who die from it, which means that, unfortunately, we haven't succeeded, as we have in other cancers, in rescuing women from that disease. That's a source of pain for a lot of us. It's a source of pain for me. When you know that you can't always help everyone as much as you'd like. And unfortunately, for ovarian cancer, there isn't an early warning sign like there are for other cancers. There isn't a good screening test. There's no test that helps us to detect ovarian cancer early. So the only thing I can advise is to be in touch with yourself, with your body. You know your body better than anybody else. You've lived with it your whole life. And my one piece of advice is never accept no for an answer within reason. You can definitely take that to a place where, you shouldn't go. But if you go to a physician, for example, and you say, "Doc, look, something's not right. I'm having this feeling, this pain, this what have you." And if your doctor doesn't take it seriously, or is at least willing to look into it to a reasonable amount, don't take no for an answer. And if your doctor's not willing, as much as I'd hate to say it, it's time to find a new doctor. Because at the end of the day, we're all human. Even doctors make errors in judgment for a multitude of reasons. And I have to remind myself all the time, Jay, you're just a regular person. You're a human being. And as such, you have to remember that humans make mistakes, but you also have to remember that humans have this wonderful quality of caring for someone. And if someone comes to me for help, I have to put everything else aside and help that person. And if you catch a doc on a bad day, when they're not able to help you, it's okay to go to someone else. That's my advice. So we've talked a lot, or I've talked a lot. I'd like to open it up for questions before we move on to the second half of the presentation. This is really a discussion. There are no out-of-bounds questions. Anything that's on your mind, you can talk about. And we'll take it where it goes. I think we have a microphone, and I'd like to make sure that we pass it around so that everybody can be heard.
Right there. I just want to ask a quick question about statistics for Cuyahoga County. If there is an increase in any area, or, basically that's the question.
Yeah, so that's a very good question. I'll be honest with you, I'm not up to date with county by county statistics. But what your question really is getting at is, are there hot spots? Are there pockets where cancer may be more prevalent? And the answer is, surely there are hot pockets. In Ohio, even if you look at any state, you will see in areas variations in cancer incidences. And what I strongly recommend, so part of taking care of yourself, believe it or not, is taking care of your entire community. Being involved in your community's health and politics, and I'm not saying it in a partisan way, being involved in politics is important. So just think about how much you depend on your environment to survive. Can you make your own water? No. Where do you get your water from? Lake Erie. Where does Lake Erie's water come from? Lake Erie water is the last stop in the entire Great Lakes system. All the Great Lakes channel into Lake Erie. Our rivers, which used to be very polluted because of industry here in this area, fed into Lake Erie. So we as a community have to make sure that the quality of that water stays high. We've done an amazing job, Ohio has, Cleveland has, in reinvigorating Lake Erie so that its water is safe. Is that a guarantee, a promise forever? No. We have a responsibility to make sure that we maintain our water supply, our food supply, our air supply at a quality that is sustaining for us. So yes, are there hot pockets in the United States where cancer incidences are higher? May that be related in one way or another to local concentrations of toxins in the environment? It's been documented many times before. What can we do about it? Be involved. Learn about your community. Learn about what's going well, what's not going well, and be part of the discussion so that we can protect what we need. So I didn't directly answer your question, but that's my feeling. Yes?
Okay. Uterine cancer. For those of us that may have had hysterectomies, do we need to do any follow-up after that, or is that the
Very
end of
good
it?
question. So follow-up with regards to, so people who've had a hysterectomy, do they have to worry about uterine cancer? It all depends on whether or not at the time of the hysterectomy, the cervix was removed. If the cervix was removed, you do not need to worry about uterine cancer. If the cervix wasn't removed, there have been cases of uterine cancer that have arisen from the cervix, because the cervix is a transition point from the vagina to the uterus. So for someone who has a cervix after a hysterectomy, those same ground rules apply. If after menopause you notice bleeding, that is a problem, especially if you have a cervix. Okay? Next question.
I have a question about HPV vaccine and
Yes.
cervical cancer. What should our mothers and aunts and grandmothers be telling their daughters?
Yes. So cervical
Tell them
cancer.
what it is about HPV vaccine nowadays.
Absolutely.
I'm a counselor.
So the question was, what are the recommendations with regard to cervical cancer and vaccination? So cervical cancer is a very unique cancer. It is one of a handful of cancers that you could consider is an infectious disease. It's caused by a virus. Cancer caused by a virus. Yes, cervical cancer is a cancer caused by a virus. That virus is called human papillomavirus. 80% of adults have at some point been exposed to the virus, and 80% of those adults have no problem getting rid of it. The immune system just gets rid of it. But what about that 10 to 20% that can't get rid of it? Well, if left unchecked, HPV infection of the cervix can cause cervical cancer. HPV infection of the anus causes anal cancer. HPV infection of the neck and throat causes throat cancer. Now, we have a vaccine, which if given to someone before they're exposed to the virus, which is why you have to vaccinate people when they're young, essentially eliminates the risk of cervical cancer. So we could get to a place in this world where cervical cancer is a thing of the past by vaccinating men and women, boys and girls, for the HPV virus. So yes, the vaccine is available to anyone between the ages of 12 and 26, and I strongly recommend it. Strongly.
I'm a cancer survivor of the throat, and I've been. I don't know if it's they seem to think that I have scar tissue from the radiation. Could that turn into cancer?
So scar tissue is very common after radiation. The scar tissue itself may not cause cancer, but anytime a person has had a history of cancer, there always is some risk of recurrence, of it coming back, right? So one of the things that's really difficult to talk to people about is that some cancers are not 100% curable. And after being treated for cancer, there usually is some risk or some chance that it could come back. The chance that it could come back is not necessarily related to whether or not you developed scar tissue, but it's related to how far advanced the cancer was when the cancer was originally diagnosed and how much of the treatment you were able to successfully complete. So the chance of recurrence or the chance of it coming back is something that you can definitely ask your doctor about, because for most cancers, we have a good idea of what the risk is that it'll come back based on what kind of cancer it was, how far along it was when it was diagnosed, and how much treatment you've received. So with those three pieces of information, most doctors are able to calculate a risk or a number of what the likelihood is of it coming back. I think we have time for one
One more question, just so we can make sure our speaker gets the time. Okay, and we're going to have more questions at the end, but we want to make sure Joy gets the time. You have a question here?
At what age should a woman stop having a pap test?
So that's a very good question. And the interesting thing is there's more than one guideline with regards to when to stop. So there's a little bit of variation from provider to provider. And the recommendation is that women who've had normal pap tests for 10 years, in the last 10-year history, if they've had completely normal pap smears after the age of 65 or after they've had a hysterectomy, removing the cervix, pap tests are not necessary. However, if there has not been consistent screening or if there have been certain abnormalities in the pap test, screening may need to be continued. So my recommendation is that each individual should have that discussion with their doctor, reviewing their pap history to determine whether it is safe to stop pap screening at the age of 65. All right, so this is really a discussion. Discussions don't have to have an end. And I'd like to invite all of you who are interested to continue this discussion online. One of the things that we've done for this event is set up a Twitter account so that people can share, to the extent that they're comfortable, their stories, their experiences, learn from each other. Inside your registration packet, there is a comment sheet, one from Dr. Bradley, which I hope you'll fill out, and one from Joy, Shirlene, and I, where you can leave feedback that we can use anonymously to start the discussion online. And if you'd like to join us online, you can find us at Twitter, and our Twitter account is TTestimony15. And you can tweet your comments now if you want, hashtag #TTestimonyTruth. All of that is in your registration packet. Scribble it down so that you can give us the feedback form, but definitely join us online. I'll be commenting, Joy will be commenting, Shirlene will be commenting, and we'll keep the discussion going. Now I'd like to switch gears. I'm very privileged and humbled to be able to have the opportunity to intersect with people throughout their lives. And I think we all are lucky to have those intersections if we're willing to recognize them for what they were or what they are. In a moment, I'm going to invite my two co-speakers to join me on the stage for a discussion, Joy Jaguna and Shirlene Davis. I met Joy at a very critical turning point in her life, which she will describe. Joy herself, however, is an outstanding woman. She's an entrepreneur. She originally hails from Kenya. She spent time growing up in Kenya. She went to school in London, and then 15 years ago, she moved to the United States. She's a woman of many talents. She grew up in one of Kenya's oldest tea families. Joy's grandfather, Arthur, is 114 years old. He is still alive. He is the oldest tea farmer in the world. And in a way, Joy is a descendant of a tea dynasty, which in a way revolutionized the way tea is manufactured and sold in Kenya. I've learned a lot from Joy about tea. One of the things I didn't know is that a lot of the tea in Kenya is farmed by local farmers who are women. Joy witnessed her family revolutionize the way tea was sold in order to better improve the lives of the women who farmed it. A lot of tea farmers used to be exploited. Joy's family played an important role in changing that paradigm to empower women. The idea of empowering women has been central to Joy. In every enterprise that she's entered into, she has kept in the back of her mind this concept of empowering women. When she was in Tennessee, her and Shirlene developed a music promotion business. Empowering women, they defined that. Started a business on their own. Joy is now CEO and principal partner in a tea company that brings those very same handmade teas from Kenya to market in the United States to the benefit of the local female tea farmers who grow it. Joy's life changed all of a sudden. She came to Ohio to give a talk to 300 women, a talk about empowering women, a talk of self-reliance. And while she was there to give the talk, she collapsed. She was rushed to the hospital and was admitted to the ICU at the Cleveland Clinic, and that's how I met her, on her deathbed. The interesting part of the story is that Joy had already been diagnosed with cancer several weeks prior. She was actually scheduled to have surgery in her hometown in Virginia for this cancer, but because she'd promised to give this talk, she came to Ohio anyway. And so here she was in a foreign place, in a city she'd never been, in the ICU, with only Shirlene for support. That's how we met. More about that soon. Shirlene is another dynamic woman. So like minds find each other. Shirlene is also a woman of many talents and skills. They've been friends for 15 years. They realized that they had entrepreneurial spirits, and they went into business together. First, in music promotion. But Shirlene brings to the stage her own sets of skills. She's a poet. She's written children's books. She's a grandmother. She studied nursing, which came in handy, by the way. Shirlene is an entrepreneur and just a fabulous person. And I think the most important part of her story is her selflessness, as you'll see. Switching from one role to the next. Friend, business partner, and as you'll soon see, caretaker. I'm very honored to know both of you. And in the remainder of our time, we're going to share our story. It's a story about fear. It's a story about hope. And it's a story about how 3 people were affected by cancer. Joy, who went through it. Shirlene, who fights beside her. And me, who was the doctor who happened to be there that day. Joy and Shirlene, will you join me? In the middle. Linda, could you hand me the remote that's on the podium? All right. Welcome back to Cleveland.
Thank you.
I think it's probably easy to say that it's so much better to be in Cleveland on your own steam.
Yeah.
So I hope I didn't take too much of your thunder introducing the both of you. But I thought we'd just kind of review how this all happened. Obviously, now you're much better than you were before.
True.
But take us back to when you first realized that maybe something wasn't right with your body. When was that?
That was in February last year, 2014. And I had a growing belly, and Shirlene thought I was pregnant. And I kept saying, this is not pregnancy. This is a distended belly, probably through gas or bloating. That's when the symptoms arose, and my legs started swelling also around March when I drank some tomato juice. So things looked pretty grim for me. I looked very awkward. My shape was distended belly, swollen feet, and there was obviously something wrong with me. But I kept believing that maybe this was something that would pass.
What did you think was going on? What did you make of these new symptoms?
I thought it may have been bloating. I was used to drinking a lot of soda water, a lot of mineral waters, and I just thought maybe I had too much gas. So I tried the Gas X. I tried milk of magnesia. I thought it maybe had been constipation. But deep inside, I had never seen myself look this way. I certainly knew I wasn't pregnant. So although I had been told to take a pregnancy test, stuck to my guns, I was in self-denial.
Had you thought at all about bringing these symptoms to a doctor and talking about it, or is that something that you hadn't considered?
Shirlene kept telling me to go to the doctor, kept telling me to go to the emergency room. But I hadn't been to a doctor in years. And the fear and apprehension of doctors, I guess, overshadowed my symptoms. And I kept putting it off, saying, well, this week I'll try this. If this doesn't work, I'll try that. I was getting a little relief with the Gas X, but the belly was still growing. So I think that's the best answer to your question.
So Shirlene, it sounds like you were kind of encouraging her to see a doctor?
Yes, sir. I was pushing her to see a doctor. I would remind her, today is Thursday. You said you would go on Thursday, or she'll say, oh, I'll go next Monday. And I said, okay. Monday would come. I said, okay, today's Monday. You ready? I'll take you. So I would encourage her to go to doctors, go to the emergency room, or, just go get help. Yes.
So at this stage, you guys were friends but business partners
Yes.
for the most part.
Yeah.
Right.
What was it like for you working with someone side by side, having a sense that something might be wrong, but seeing that it was being overlooked?
It gave me a sense of powerlessness. I felt like I can't get her to go to the doctor. What's going on here, And with me trying to force her, I realized that wasn't going to happen. She wasn't going to go. And me trying to talk to her and bargain, negotiate with her, why don't you go to the doctors on Tuesday and then we'll go shopping or do something, on another day. But I don't know, I just felt a hopelessness or something, or powerlessness.
So at some point, the symptoms got worse.
Mm-hmm.
What happened that finally did bring you into the emergency room?
I started getting uncomfortable. The belly was big. It was as big as a 6-month pregnancy. And it's so funny because people would look at me And I would get these looks in the stores, you know, when is the baby coming? Which I found quite comical because I knew I wasn't pregnant. But, you know, in essence, I was getting, it was very uncomfortable. And I was short of breath. So this particular evening, I told Shirlene, we're going to go to the emergency room because I'm in pain. That's what brought me to the emergency room in Roanoke, Virginia.
Now, you had mentioned earlier that there was some fear that you had about going to see the doctor.
Right.
In retrospect, do you have any idea of what you were afraid of?
Well, this comes from my past. I come I've lived in different parts of the world. I've lived in Kenya and I've lived in England. One thing that was common, a common thread about hospitals and doctors is these places smelt the same. This sterile smell of what they used to call Dettol, which was an antiseptic. So there was a horrible smell associated with hospitals. And then the doctor was always, had a grimace and always had bad news. So I knew that, and this was when I was a child. So going to the doctor was never a treat. I didn't get a lollipop after going to the doctor or to the dentist. So I knew subconsciously I didn't want to go to the doctor because I would get bad news. I could see I had bad news. I didn't want it confirmed by a doctor.
And so in a way, ignorance was bliss.
Ignorance was bliss.
So you finally did go because you were so distended.
That's right.
Your legs were
Swollen.
so swollen
Yes.
that you finally went in.
Yes.
And what happened when you got there?
Well, when I got there, they told me I was anemic. They gave me fluids. They took me through various tests. They did some scans. I think they did a ultrasound. And the ultrasound showed that there was something wrong with my liver. And they talked about the fact that I may have cirrhosis of the liver. And that was very alarming to me because I had been an alcoholic at one point in my life, but I hadn't drank any alcohol for 10, 12 years. So I was fighting back tears and saying, am I being punished for my years of, you know, being a drunk, drinking rather? So that's what they came up with. And then they said, no, we have to do more tests. So I remember seeing when I was in the emergency care, and I think 3 doctors came in. And that's always a bad sign when more doctors come in than is normal. You know, the more doctors that come in, the worse your situation is. 3 doctors came in, and they didn't look too pleased. And one said, well, you know, the good news, it's not your liver. So, you know, I immediately rejoiced. And looking at the other doctors, they didn't seem to have that same exuberance and joy that I had. Somber, as they told me that I had cancer. And when they said cancer, it was as if a door was closed in my mind. It's as if my world stood still. Everything stopped for me. I felt like I was in slow motion. And everything else was going on. And it was the worst. It was like a death sentence. That's what it was, a death sentence.
Shirlene, what was it like for you at that time to hear that news?
Shocking, very shocking. Wondering, you know, I thought to myself, it's the beginning of a journey for her, but it's the beginning of a journey for all of us, meaning her family, myself, and what are we going to do, you know? Just a lot of questions, shock with a lot of questions. Mm-hmm.
So you were in the hospital for a few days, and at the end of your hospital stay, you had a diagnosis.
Yes.
And it sounds as though the plan was to get you ready for surgery.
Yes.
To remove some tumors that were growing in your abdomen.
That's right.
Causing your legs to swell.
Yes.
Causing your belly to be swollen.
Correct, correct.
And in the time that you had between leaving the hospital and surgery, you had a talk to give.
Yes.
Here in Ohio.
Yes.
Now, you should know that Joy now lives in Roanoke, Virginia.
Yes.
And you and Shirlene were coming to Ohio to give a talk.
Yes.
So what was that talk supposed to be about?
Empowering women, exploring sustainable economic development, and trying to bring the bridge between, we were talking to people in the labor union, women who are unionists here. And it was going to be a very comprehensive talk on how the women, the tea farmers, organize themselves similar to what they do here. And they were looking forward to it, and of course talking about tea. And I had given my word, I had signed contracts. I wasn't going back on my word. I would do that talk if it killed me.
So, Shirlene, with all this new news, the swelling, the new diagnosis of cancer, needing to have surgery in 3 weeks, what did you think about leaving Virginia to come to Ohio to give this talk?
Well, as you said, I'm a friend to Joy. You know, I'm a friend. And I said, if Joy's going to go, I'm going to go with her. You know, I'm going to go and support her and be there for her. I never thought that she would collapse because her doctor in Virginia didn't want her to go, but she went anyway. So I thought, okay, the doctor didn't really make a big stink out of it. So I thought maybe it's okay. Mm-hmm.
So you get to Ohio. Shirlene, what happened?
Joy collapsed at the elevator. They help her up. She comes back in the hotel room, and she says, Shirlene, I have to go to the bathroom. So I said, well, okay. So she goes to the bathroom, and some friends of ours, we were in the sitting room in the hotel room, and I heard a thump. And I said, did anybody hear that? It's like, oh, okay. I said, oh, maybe I'm just hearing things. So I got up and went in the bathroom, and Joy had collapsed again. She had passed out, and she had flipped all the way backwards. Her face was against the bathtub on the floor. So I pulled her up by her shirt and start patting her on her face, putting water on her, calling for the other people to call 911, getting her pulse, trying to find her pulse. She came to. I couldn't get her pulse here, so I came up here. I got her pulse at 32, something like a 32. So I start calling for our friends, for somebody to call 911. And she's coming back and forth, in and out of consciousness, saying, I'm not going to the hospital. Don't call 911. I'm not going. Back and forth and on and on and on. And I told some of our friends, I said, call 911, tell them to bring oxygen. And she's in and out of consciousness. I just gave them a full report of what was going on with her, so they would know exactly what equipment to bring up and to bring a stretcher and be prepared to take her out to the hospital.
Joy, what was going through your mind? What were your recollections from that encounter?
I went to the bathroom, and I collapsed. And to be quite honest with you, I just kept seeing a white light. I kept feeling that I was coming out of a place and going into another place, until Shirlene started slapping me and telling me to come back.
Oh, yeah.
And she said, I need you. Your brother needs you. Your sister needs you. Your father needs you. You're not leaving me. And she kept slapping me and pouring, and that white light disappeared as quick as it came. So after that, I kept telling her, I remember I told her, look, don't call an ambulance. I'll be fine. I'll just lie down on the bed, and then I'll do the talk tomorrow. And the ambulance had already come, and I said, I told you not to call the ambulance. I don't want to go to the doctor. And they strapped me up in the stretcher. I kept telling them I don't want to go, and finally I was whisked off to the emergency room.
So there you are in the emergency room, And what did the doctors there tell you?
They said that I was bleeding internally. And I didn't believe them. So we were in a twilight zone, so to speak. Shirlene, myself, and one of our friends called Meredith. And the doctor kept coming back and saying, you're bleeding internally, so we have to take you to get surgery immediately. And I'm still talking about giving a talk. So I tell her, look, I feel so much better. You've pumped me up with these wonderful fluids. I was sick, but I am well. I'll come back to the emergency room after my talk, and then we can proceed with surgery or whatever else you want to do. And the doctor was very somber and said, you don't understand. You may not live to see another day. And we're not going to allow you to leave this hospital unless you sign off on all this paperwork. Sign off on paperwork? I said to Shirley, they got to be crazy. I'm not signing